Commissioners, are there any items on the agenda that you have any questions about, or are there any other items that people would like to add to the agenda to discuss after we're through these items?
Mr. Chairman?
Yeah.
Sir, I'd like to circle back around on an email we got about, I guess, 3 weeks ago about the safety at the polling places.
Okay.
Could we just maybe have a little brief discussion if we have time?
Sure. Anything else?
I want to move up the Inca barn that's in new. I think it's in new business. I want to move it up to the first because I'm not going to be doing the presentation. It'll be a couple people from the school that'll do it. So I think it's on new business, but it's the last one. So I'd like to move it up to the first so they can.
In the regular meeting tonight?
Yeah, it's in the regular meeting. Sorry. I thought that's what you were asking about the regular meeting.
That's okay. Does anybody have any concerns about that? Okay. Is there anything else folks would like to discuss at the briefing meeting today? Okay. And Joe, just if I don't mention that, just remind me when we start the meeting. Okay, great. All right, very good. So we're going to start off with staff updates on COVID-19. And Stacy Saunders is here, and Fletcher Tove. Good to see you both.
So we've got a bit of a team effort today, sorry. So you'll hear from me and then Fletch and Tim as well about some of the impacts of COVID as requested and planning. So I'm going to start with our traditional COVID update. Thanks, Max. Max, do you see that it's? Okay. There we go. It wouldn't have been nearly as good without the pictures. So thank you, Max. So just want to start off and let you know that for us here in Buncombe County, as of this afternoon, we've had 3,307 total confirmed cases have been identified, and sadly, we've experienced 89 COVID-related deaths. About 89% of those COVID-related deaths in our community as a whole have been in folks that are 65 years or older, and the vast majority of our COVID-related deaths have also been associated with long-term care facilities. You'll also see that we continue to have about 4,000 tests administered within our community. Not just by our community testing sites, but by lots of community partners as well. So about 4,000 tests administered each week, and that gives us a total of almost 76,000 community tests done thus far. So I'm going to zoom in just a little bit as requested.
Thank you so much.
To sort of see just the last part of our epi curve. And just to refresh folks, what you're seeing here is July to our most current data. And you can see that we saw that significant decline from mid-July into August, with stabilization and leveling as we entered September, and leveled throughout September, and then started to see again that an increase. And several of those cases beginning around September 21st through the 23rd, actually had an onset of symptoms that still would have been that very last part of the incubation period for our Labor Day holiday. And as you've heard me say before, historically, we have seen an uptick of cases after major holidays. That doesn't, however, account for our most recent cases per day. And that you can see they're outside of that window, but are falling within that window following the phase 2.5 implementation. And we just went into phase 3.0. So just like major holidays, it's historically we've also seen an increase in cases shortly after some of the lifting of restrictions. So you can see that we're just under 30 new cases per day, and we'll be monitoring this. The last couple of days, you can see that it's starting to show a little bit of leveling, but it's a little too soon to say that that is a level trend or that that's decreasing trend. So we're going to be watching that for the next several days to see where that's headed. This is a great, usually I wait till the end to say that the 3 W's are really important, but I think it's really important here to say it, that as restrictions do get lifted, it is very important that folks remember the 3 W's of wear, wait, and wash, that it has been important, it is increasingly important as restrictions get lifted and we begin to interact and have more interactions within different venues. So remember to wear your face covering, wait 6 feet apart, wash your hands often. And our percent positivity, no surprise here either that as those cases have started to increase in the last several days, we've seen our percent positivity also increase. We were around 2.5%. Our current percent positivity is right at 3.3%. We've also seen at the state level that percent positivity that had gotten as low as 5% has also increased, and it's at 6.4% as of today. Just of note that the state and the nation are seeing similar trends as that we're seeing right now, which is over the last week or so, increasing cases per day. This is the COVID-like illness. Again, just as a reminder, it shows the percent of emergency department visits in North Carolina for COVID-like illness, and COVID-like illness is one of our early indicators. This particular graph goes through the week of September 26th. And just to show you that that bright yellow line is Region 6, in which we are in. And you can see that overall, compared to some of the other regions, we have had less of a burden of COVID-like illness. Yet in the last couple of weeks, you can see that that had an uptick as well, which this graph ends on the week of September 26th. And so if you were to sort of transpose both this graph and the new cases per day epi curve, you'd see that those are following each other. Now, usually this visualization looks a little different, and I apologize. The platform in which we get that data from the state is not functioning correctly, so I had to use a different visualization, but same information. Usually you see this as just a dark blue bar graph indicating our specific region. And here you see our region compared to the 6 other regions in the state. But it's the same information about the hospitalization. We actually are that orange line that's toward the bottom there. That's our region. And again, you can see that overall, compared to other regions in the state, the burden for our hospitalization has been lower, but we are seeing in that last data point of October, dated October 2nd, just the slightest bit of increase there. And so right now I'm going to turn it over to Fletch and Tim to go over the impacts of COVID-19 as requested by commissioners a couple of weeks ago.
Good afternoon, commissioners. So as Stacy said, wanted to take a few minutes to talk about the impacts of COVID-19. And the way that we'll frame the discussion today is sort of economic impacts that we've seen, but also want to talk about sort of the revenue impacts that we've seen in some cases, and then additionally want to talk about in sort of the change in how our services are used as a county, because I think that combination of variable gives us a sense of how we're doing. The caveat that I want to put in the front of this presentation, though, is I'm not here today to give you a projection or a forecast. There's lots of folks that are paid very well in this world to do things like that, and I'm not one of them. So everything I give to you is going to be public data. These are data sources that we trust, that anyone could access, and to give you an idea of where we are today. Not intended to give you a forecast, but you'll be able to draw some conclusions as we look at some of the trends. So a few of the things we'll talk about today, we're going to talk about employment, housing security. We'll talk a little bit about revenues, food insecurity, as well as mental health. And so as we walk through, feel free to ask any questions. So one of the first places we want to start is the unemployment rate. We've heard so much about this throughout the pandemic. And, what I want to say is as we start this conversation, context really matters. So a lot of the data you're going to see from me today is going to be referring to the Asheville MSA. And so the MSA is your metropolitan statistical area. That is, for those listening at home or in the audience, that's not limited to Asheville city limits by any means. Our Asheville MSA actually represents something broader, which includes Buncombe County as well as some surrounding counties, including Henderson County. The reason that's important is from an economic standpoint, regions matter. The economy isn't restricted to county borders, and so we want to talk about it in a more broad perspective. So the big thing to keep in mind as you look at this slide is kind of that blue line that's obviously jumping up. So, in April, we went from, as an MSA, having the lowest unemployment rate, in the state, all the way up to 16% unemployment. So, we jumped from about 3% up to 16%. Tremendous impact in the April and May timeframe. But you can see that unemployment rate starts to drop down in June. So we're closer to 8%, slight spike in July, and then continuing down into August, where we currently are. And so we're currently at about a 7% unemployment rate. This is still not good for where we've been. If we look at just this time last year, we're closer to 3%. So clearly unemployment has had a big impact in our area. But that said, we have seen a lot of folks be able to get back to work, and so that's a positive as well. As we begin to think about unemployment, the next question is, what's the status of jobs in our community? And, I'll confess to you, we don't have a great source to say, hey, this is how many businesses closed. That type of information, there's not really a good way to do it timely. But what we can say is how many jobs are in our community. So again, we're looking at the Asheville MSA, which again is a regional measure looking at Buncombe, Henderson, and others. And so we're looking at total unemployment from this perspective. And what we wanted to show you is kind of that trajectory. So you can see in April, again, we have a really big dip in total employment. So we shed, almost 30,000, 40,000 jobs. Not a good thing. However, you can see we start to have an uptick in May through August, so sort of kind of a Nike swoosh is what some people have described. So this gives us a picture of how the overall jobs are doing. But the reality, and I think most of you know this, industries have been impacted very differently by COVID. Some have been almost unaffected, where some have just been decimated. And so while this gives us a picture at the top, we wanted to show you some select snippets of other groupings of industry, and this is all based on the U.S. Bureau of Labor Statistics, that have been impacted differently. And so in this sector, we're looking at manufacturing. And the manufacturing sector has been hit differently. And what you'll see is a pretty precipitous drop in April, but sort of a plateau. So we haven't seen a really large bounce back in this industry, which when we think about it is not terribly surprising. Manufacturing includes many industries, some of which who have been impacted pretty severely. One in particular that comes to mind is the aerospace industry. We know that travel is down for many reasons, some including regulation. But other industries, I think we saw as recently as over the weekend, industries specializing in products that can be used for hygiene or sanitation. We've seen an increase in those industries. So there's been some differentiation there. As we begin to look at another industry that's been impacted slightly differently, and you should be looking at the yellow line just to track with me, the mining, logging, and construction industry. So this is fascinating because when we talk about total employment, we can actually see that in August, that yellow line gets above our 2019 workers on payroll number, as well as our 3-year average. So whereas our manufacturing industry has kind of taken a dip, our construction industry has actually exceeded kind of where we were just this time last year. So again, kind of demonstrating, industries are not all created equal, and some were impacted differently by the pandemic. Shifting to a less positive story is the one of leisure and hospitality, and I think this is very close to many of us. We've talked about it a lot. We see that we dropped almost 20,000 jobs from March to April in this industry, which is an incredible impact. I guess the positive of this is that we have seen a sharper recovery. So on the other side, May through August, we've recovered 12,000 jobs, which is a positive thing, but however still leaves a pretty significant gap of about 8,000 to 10,000 jobs that have not been recovered at this time. So a more positive story in the sense that we're recovering more quickly, but nonetheless still demonstrate a pretty significant loss. Our next slide, so we presented kind of unemployment, and then we jumped into the total number of jobs in our community. The next that we wanted to talk about was kind of the impact to one of our major industries, which is, the hotel and leisure industry. And so this data gives us a sense of, room sales and how many rooms are being sold. The way to look at this slide is, each line represents a different component of the industry. So the orange line represents our hotels and motels. Your bed and breakfasts are represented by that sort of light blue, and your short-term rentals by the yellow. I think the major takeaway here is for a lot of our hotel and lodging industry, the impacts have not been that significant, with the exception of your hotels and motels. That orange line that's right at the top, if you compare the very front of the slide, July of 2019, to the very far right, July of 2020, you can see that our room sales, the dollars generated through hotel nights, is down almost $15 million, which is a pretty substantial impact. When we talk to Explore Asheville and the groups that support our hotels, we've asked them, so what's the state of your recovery? And so this is more anecdotal than data, but what we found from those discussions is that our weekends, we're seeing kind of a recovery. We feel pretty good about where we're at with that from a hotel perspective. However, we continue to struggle throughout the week. So your weekday travelers there's just not as many. They point to a couple reasons for that. One is events. We just don't have as many business-related events coming into town for a variety of reasons. The primary one being mass gatherings. Those are restricted, so you would not expect to see that. So event venues are not as busy as they normally would be. Additionally, we're seeing that business travel isn't quite as required as it once was. More people are virtual than ever, and so you're just not seeing those types of travel. So from an anecdotal perspective, weekends seem to be recovering locally. Weekdays continue to be a struggle for our hotel owners. Our next point that we wanted to reference was, so we have an idea of job security. We have an idea of, how our tourism industry is doing, represented through hotels. Next, we wanted to talk about housing security. So what's going on with evictions? And so this data comes to us from our Buncombe County Sheriff's Office, and we've spent a good amount of time talking to them about it. And The key here is you can see there's clearly a gap in this data. So April 2020 through June of 2020, you see that there's no evictions, basically. And the reason for that, as you may recall, was there was a federal restriction that did not allow these evictions. However, in July of 2020, you can see that we're beginning to see evictions again. And so the story here, and for more details on this, we could certainly get it for you, but there's about a 40-day period between the initial federal restriction and then the later CDC restriction on evictions. And so during that time, we began to see, a spike. A key piece of information to know as well, and I'm not the expert on this, but with our CDC eviction policy, you're required to submit a declaration on your behalf. So your protection, quote unquote, is not automatic. You have to take steps as a tenant or as a landlord to sort of protect yourself. And so that's a key distinction from the prior regulation. Again, I'm not the expert on that, but wanted to give you a picture of kind of what that looks like. I'd also be remiss if I didn't say this, but in our discussions with the sheriff's office, the sheriff's office is required to serve any type of civil paper, regardless of their perspective on it. And so they wanted to make sure that we were clear on that. This is something they're doing because they have to, regardless of the obvious discussions we've had on COVID. So that was my last slide, and before I turn it over to Fletch, I wanted to see if you had any quick questions on evictions or any of the employment data we presented, discussion on travel. Fletch will get into food insecurity, mental health when he steps up here, but if there's any questions, I'd go ahead and take them now.
Tim, thank you. This is really helpful. As we look at the more recent data around evictions, has the program that the county's providing some funding for around, I guess, legal representation for tenants during evictions, has that really kicked into gear yet? It has. Okay, so presumably that number would be higher if not for the services being offered. Okay. It would be helpful just to learn a little bit more about what's going on for the people or families who are continuing to be evicted under these circumstances, and thinking about whether there's any more fine-tuned strategies that could provide support.
Absolutely. We'll definitely take that note. I'll also sort of foreshadow to a discussion we'll have later in the evening during the regular meeting about the CDBG CV grant and the support we're pursuing there related to evictions, utility assistance, and other things. So.
Thank you.
So just got a comment. Being a member of the CDA, I'm also on a search committee for the replacement CVB. And some information came out that one of that a source that a particular location was using was the University of Virginia on COVID information. It was pretty unique, and but if I just encourage y'all to look into that. I can provide you maybe some additional information, but it was pretty interesting information they were able to gather from there. So,
yep. Thank you, Commissioner. And something I'd always say: context matters, data sources matters. There's tons of data available, and we tried to stick to our publicly available data. There's many different measures that we could have brought to the table today, but we've tried to focus on just a few. But
it's good information.
Absolutely.
Tim, on the evictions, can we go back to that slide, please?
Of course. Max, can you pull up the eviction slide? Thank you.
Max. I'll go ahead and try to ask the question as we look at it. So are these looking specifically at evictions that are related to COVID-19 and job loss? Or is this just evictions in general? Because, people who are struggling financially are going to continue to struggle financially, but are these separated?
Sure. So I'll confirm that for you. My understanding is it's all evictions, but I'll definitely confirm.
Thank you.
Of course. If no questions from me, I'll take a seat and ask Fletch to come up to follow through on the remaining slides.
Good afternoon. So we're going to talk about food and nutrition services first, and nutrition insecurity. So this is a pretty dramatic graph. You can see a transition to March to April. We had a big spike in our FNS cases, working through our Women, Infants, and Children program. About 3,000 cases over our two-year average, and currently have 7,000 more recipients than this time last year. And we're anticipating that trend is going to continue, throughout the year, well into next year. And then come back to this slide. I want to start with this one. This data comes from the crisis text line, and it's a resource generally for younger adults, from teenage to mid-20s years. But this is over almost 5 million data points captured over the last several years. And what we're looking at specifically here is in the reddish orange is the 2019 data, and in 2020 the teal is the 2020 data, and it's grouped in these categories. And I'm not going to get into the specifics of each one, but the takeaway from this slide is that in 2020, almost across the board in all these categories you see here on the left, we see significant increases in these young adults using this crisis text line, for depression, self-harm, abuse, substance abuse, isolation, and suicidal thoughts. And we're going to jump back to this other slide and look at this geographically here. But this is some of the same categories, and we could look, and when you're looking at this map, red shows an increase from 2019 to 2020, and the blue shows a decrease. So if we look at, apologize, I don't have better clarity on these maps, but if we look at Western North Carolina, on just about all of these, we're going to see an increase in all those categories listed on the left. Notably, some places where we see a decrease is in E in bullying, and I in suicide. And we don't have a clear interpretation of that, but there might, a logical assumption we've made is that, having kids out of school may have reduced some of that ability to bully, which may have a secondary correlation directly to suicides. But just to give a picture of, this is national level data, but we can see the region, and just in general, the takeaway is that our young adults in particular, teenagers, are seeing a much higher levels of stress and crisis level events across the board. Any questions about those slides? I'm going to turn it back over to Stacy Saunders for a moment.
So the last portion is just to give you an idea of what we're planning and what we've been doing, and what will be done in the next 4 to 12 weeks, I suppose. Starting with, what are the things that we're thinking about, and as public health and other partners, much of our planning efforts have been focused on the time that we find right now, which is the flu season is upon us, and COVID is still circulating. So, just want to reiterate why this is what we're talking about and why it's so important, which is that we have 2 serious respiratory illnesses circulating at the same time, and reducing the spread of COVID and flu is really important for our high-risk groups, and also to be sure that we reduce the burden to our health care systems. And so many of those who are at high risk of illness for COVID are also at high risk for flu, and those are the groups that we're talking about, with the over 65, those with chronic health conditions, individuals who are in nursing homes or long-term care facilities. And in addition, for our children under 2 and pregnant women, we're also concerned about them for flu season. So, flu is available flu vaccine is available in our community. The CDC recommends that folks get their flu vaccine, and COVID testing is also available in our community. It's recommended for those who have symptoms, and also for those who believe they may have been exposed or a close contact. And the planning teams have been spending a lot of time thinking about these areas with limited access for testing and vaccination, and that's what I'm going to go into right now. And so originally we had 3 fixed sites for community COVID testing, and due to low utilization within one testing site, what we decided to do is maintain our 2 fixed sites on Sundays and Thursdays, which will give us 8 fixed sites scheduled for October. And then that 3rd testing site we have repurposed to be more of a pop-up testing site that would rotate throughout the county. And we have 7 pop-up sites that are scheduled for October in conjunction with specific community partners in order to reach critical and marginalized populations like our historically Black neighborhoods and our Hispanic and Latinx. And so you can see there's a 15 total COVID testing events scheduled for October. We have one combo event where COVID testing and flu vaccine will be offered in a drive-up approach in October. And additionally, we've added 2 flu vaccine events for October, also partnering with some of our community partners to reach our populations with little or no access to flu vaccine based on some mapping that we did of flu vaccine availability, and really wanted to work with our community partners to get into communities where there might be very limited access. I just want to reiterate that additional COVID testing and flu vaccine oftentimes are available at urgent cares, FQHCs, our community health centers, pharmacies, and also at our flu vaccine is also available at our Health and Human Services Immunization Clinic. So our October calendar is really full, and very appreciative of community partners who have come to the table with us and helped us identify locations and spots and populations that need it. So identified locations include here in downtown, Emma, Shiloh, and other areas. And talking about planning, can't talk about planning without thinking about COVID and a COVID vaccine. And so I just want to say that there are no approved vaccines at this time. I do want to draw your attention to the New York Times vaccine tracker, which is very interesting and keeps pretty up to date about where the process is for many of the vaccines that are being tested right now. But just to reiterate, there's no approved vaccine at this time. Even though there is no vaccine at this time, one of the things we do in public health and with our community partners is plan for or anticipate the possibility that there could be. And so part of public health preparedness is to practice, the point of dispensing or pods exercises where we get to exercise in real time what it would be like to do mass vaccinations or to do point of dispensing. And that all is in order for us to practice in the event that we do have a vaccine for mass distribution at some point. And so in addition to regular public health preparedness exercises that we do, we're applying some of those lessons learned from our community testing sites as to also inform our planning process. Drive-up types of approaches, being able to pre-screen or register, those types of things, trying to apply those lessons learned to planning for potential COVID vaccine. I will say that though we don't know much, we can make some assumptions in that it's likely that any approved vaccine will have a tiered or a staggered distribution, which means it's likely that there will be some type of prioritization of the vaccine and then work its way towards mass or general population. But all of that to be determined, but just wanted to let you know that these are things that are on our radar that we're planning for and trying to anticipate as much as possible. Also on our radar is supporting our K through 12. So what we've been doing is providing data and indicator updates, but also consultation and technical assistance regarding the Strong Schools Toolkit and other Department of Health and Human Services guidance. But I also wanted to bring attention to that we have implemented a school nurse case investigation training and a team. And as in an effort to plan for as students come back into classrooms, we wanted to equip our school nurses with the same case investigation training that our communicable disease nurses have at Health and Human Services through our Department of Public Health. And our communicable disease nurses train school nurses in case investigation. And again, as students enter classrooms again, identified school cases would be assigned to our school nurses. And those school nurses have a team lead back at Health and Human Services. And so they're serving their population and work alongside our nurses at Health and Human Services to best provide services to our schools in the event that we identify cases. And then lastly, I'm going to turn it back over to Fletch just to talk about a couple of other related items, and then we'll take your questions.
Just want to speak momentarily about planning forward for the winter and into next year. Part of my role as the Public Health Preparedness Director is coordinating shelter training. That works in fold with emergency services and the American Red Cross. We all provide a component of that. This year in particular, with COVID upon us, there's been guidance from several different agencies, from the CDC to the Red Cross from the state, about how we would do any kind of mass sheltering. Fundamentally, it's the same. We just have to make sure we have space available to keep that 6-foot distance, have masks available. We've had several meetings between emergency services and Red Cross on this, making sure we're on the same page. There's also going to be American Red Cross, their intention locally this year is, if we do have any sheltering incidents, to try to put those people in hotels, which in the past, depending on the number of people available, we've just set up shelters. Historically here, our shelters have been on the smaller side, maybe 10 people or 15. A couple years ago, we happened to get up to 60. But they're much more inclined to use hotels this year just to keep people out of that, open gathering situation. And then another concern we have as we're working our way through hurricane season is if people have to evacuate or shelter on the coast, and with this increase of 6 feet distance, they may not have the space and resources. So the state has a plan to bring those people requiring sheltering west across the state, and the state's already identified shelters in western North Carolina, and those are going to be state-run shelters, which we can assist with, but they'll be under the guidance of the state. Discussing Code Purple, we've had many planning efforts in progress. We know that locally we've been able to increase our capacity in anticipating requirements due to COVID. One thing we're still working on, which is a current gap, is our daytime warming stations. So this is a little bit different than Code Purple itself, but where during the day, people who need the resource can come inside indoors to warm themselves. We're still working that issue. I also want to bring attention to another line of effort that stemmed originally from the EOC, Emergency Operations Center. We set up for COVID. We brought so many great resources into the fold from the community volunteer groups, and Rachel Nygaard's been working really hard to kind of capture that and use that as a springboard to make that a continuous, permanent aspect of our county response, are these COAD and VOAD groups. So that work is ongoing as well. Any questions about future planning? Great, thank you.
Okay, yeah, I don't get no questions, so thank you, Stacy and Fletch and Tim, for updates. So I guess next is our petition to permanently close an alleyway. Michael Frew.
Yes, sir. Thank you, everybody. Coming up in a couple weeks, 2 items. First, the petition to permanently close an alleyway. And Max, if you can pull up that picture, is probably the best thing to show. This is a GIS screenshot of a piece of property on Biltmore Avenue. That's the plan. You see down there, it's hard to see, but you see a bunch of rectangle boxes. That shows an unopened 8-foot alleyway on the south end of the parking area across the street from where the car dealership used to be on Biltmore Avenue. If you can go to the GIS shot. Okay. And yes, if you can push that down a little bit. So that parking deck is the parking deck at 356 Biltmore Avenue, where we have RHA and some other services through the Health and Human Services. That parking lot you see there is about 9.9 tenths of an acre. That was purchased a couple years ago by an entity called Milan Asheville LLC. They got approval from the city to build an extended stay hotel on that site. That was approved in March of 2019. This was about to come to this board back in pre-COVID in January. And that area shown on the map on the screen is pretty accurate. I pulled in one day to see where the property stake was. So it's that 8-foot portion in that grass median between our drive to the parking deck and that parking lot where they want to build. So what happens in the mechanics of closing an unopened street? And in old plats, I saw that there was a number of small houses extending up and down that east side of Biltmore Avenue 80, 90 years ago. And this unopened street just never got permanently closed. So adjoining owners would petition the city to say, we have no objection to you closing this unopened street. It won't hinder our access or injure our property interests. And if the city council would approve, that 8-foot alley would just close up into the middle such that both property owners, that'd be the county and Milan, would get 4 extra feet over that 137 feet of length. If there's no questions, I mean, this will be on before the board on October 20th, and we just suggest or ask that this board approve to sign and execute a petition that there's no objection to closing that street.
I'll just say that some of the information we get to look at is just riveting.
It is.
It really is.
But it has to be done.
It's got to be done. Yeah, it's cool.
All right, thank you very much.
Yes, sir. I think I got the next one too.
Yep.
Yeah.
Keep on going.
So that's the resolution declining offer to use property at Emma Elementary School. As you all well know, I mean, the county's been focusing on funding and helping with early childhood learning and education over the past several years. Buncombe County School Board has been cooperating and working diligently with that effort. Many of you know about Verner Center for Early Learning. They have, I think, 3 schools locally, and they're working with the county school board to construct a building on a there it is, thanks Max, on a just under 1 acre piece of the Emma Elementary School property. So the idea is to lease that long-term to Verner for the construction, use, and operation of that site for early childhood learning. And what the school board has to do by statute is first offer that surplus property. They declared the property surplus some months ago. They have to offer it to the county. So the ask here is that this board decline offer to use the property for any other use or purpose and just allow it to be used for early childhood learning. That'll also be coming in before this board on October 20th, and that'd be a formal resolution stating intent to not exercise right to use that property. If there's any questions, be happy to answer. This partly falls into the same category as Commissioner Belcher mentioned, but this is for a good cause.
Well, maybe not. Can you bring the map back up? Okay, so orient me where the school is, somebody. If you can, so.
I just see existing playground area down there below the green.
Okay.
And 2 buildings to the right. Oh, excellent.
Yeah, it's really good. Okay, that helps, thanks. And the main, where's the main road in relation to this? Somebody point that out to me.
If you can zoom back up, zoom out, there might be an area map in one of the corners, Max. No, just make this small scale, zoom back. Top left or top right?
Probably, yeah. That's fine, that's all I need. I couldn't pull that up on my link. When I would click on it, it wouldn't go to that. So maybe if you could send that to us.
Okay,
I mean,
for
I'd
the
like
20th,
it.
I'll be sure to pull up a better area map for this.
Yeah, I mean, if I could get the map now just to look at it, that would be cool. Because I
Sure.
can't pull up, just not right now. I mean, just emailed
Okay,
so I could see it.
we'll
Thanks.
do both.
Thanks.
Get that covered.
All right. Thank you, Mr. Frew.
Yes, sir.
All right. Next up is a discussion regarding library fines, feed that write-off, and Jim Blanton and Don Warner are here to help us with that.
Afternoon. So I'm here today to talk about a request to waive fines and fees older than 3 years. Last year, the finance team reviewed our debt balances for the library dating back to 1994, and they recommended that we clear our outstanding debts that were older than 3 years. That is in recognition of the fact that the fines and fees older than 3 years represent an uncollectible balance, having the effect of inflating our receivables balance. And they indicated that setting a time limit of 3 years before clearance would be appropriate and consistent with best practices. So the library board is an advisory board, as you know, but one of their duties is to set our fines and fees. And so county legal recommended that we make a formal request to the board to consider the action. And so they discussed that at their November 14th, 2019 meeting, and all voted in favor supporting that request. So per that vote, where they were asking the commissioners to forgive all outstanding library fines older than 3 years. So our request is that the library board, based on the recommendation of the finance department, requests that the board of commissioners approves adopting the practice of clearing the library fine and fee debt older than 3 years.
Yeah.
And the current amount on the books is $1,437,413, again, going back to June of 1994. Questions?
Back,
There's some sticker shock.
oh my goodness. Back at 1.7 million?
Could you just maybe say a few
Help
more
us,
words
son.
about like 20
Yeah,
years?
yeah, bring that slide back
Like,
up and
Sure, you
talk
got
to
it.
us a little
Yeah,
bit
I mean,
about it.
is it the kind of situation where if you don't pay, then there's interest on it or additional penalties?
There's-
Or are those just actually the base fees that just didn't ever get paid?
Correct.
Or
a
were we just
combination
kidding?
of lost items plus fees. So it's all kind of wrapped in.
Okay, so it's not like if you don't pay in 90 days, you get hit with something else. These are just
Oh, no interest. There's no interest. No, sorry.
My son lost a book. Sorry.
Yeah.
So
What's that?
does that number reflect, once they get to a point where the cost to replace a book is like X amount of dollars, and we stop that, or we just keep going?
So what happens is we have a fine threshold of $10. So once it hits $10, the fine stops accumulating. They can then bring in the item and pay for the item and usually away the fees at that point. We do use a collection service that engages with the patrons and makes contact. We make an initial contact before we send them, and they are sent at a $50 threshold. So until their combination of fines and fees and late items hits $50, they stay with us. When they hit $50, then they go to the collection service, and they attempt to make contact over the period of 154 days. Past that, though, there's no consequence. They don't get reported to a credit reporting agency or anything along those lines. So it's just a kind of a continual effort of making contact to see if we can get those items back.
And if we don't get the items back,
They end up
We
on
go
this
in.
ledger.
they go on this list, but then we go out and buy it.
Potentially, yeah. If it's something,
replace it.
if it's something that we feel it's worth replacing, we would. If it's something that's, not high demand anymore, we might buy something else. Yeah.
I'm curious. Do we know how much we collected during that time?
I'm sure we could find out. Well, I won't say I'm sure, but we could try to find
I
that
would
number and
like
see
to
what the
know
total
that.
period over that period.
Yeah, I would like to know that. Thanks.
Sure, absolutely.
This is going back to 1994. Is that what the date is? Or how far back is this going?
94.
94.
Yeah.
Okay, so we are talking about 24 years. So it's
Yeah.
a big number, but
26
it's
years.
20, okay, right. No,
Yeah.
thank you, right. So it has taken a while for it to build up to this
Yeah.
number, so, all right. All right, thank you for the update.
Oh, Don has-
Mr. Warren?
And just so you're all aware, this is kept on the library, their set of books. So we don't see it on our ledger. So when we discovered this, that's when it's like, we need to actually record this on our ledger. So we recorded
Yeah.
a huge receivable and the corresponding revenue. So now we've inflated revenue, so it's not realistic because we know we're not going to collect it. That's why we're asking for you to write this off.
Thank you.
All right.
So Don, I'm assuming your department through just routine, X, Y, and Z, found this out, is that correct?
Yeah, the more we dig into stuff, the more we just find stuff. It's just kind of the
Appreciate you
way
doing that.
things go. But, Jim wasn't aware of it until we started digging, and then
Sure.
we're like, wow.
Thank-
Wow. Yeah, we didn't want to bring it to you, but we thought you might want to see it.
Yeah, I appreciate it.
Yeah. This will be on, assuming that you're all good with eliminating this uncollectible debt. It'll be on 2 weeks' agenda.
Yeah.
And it'll just be a consent item to eliminate it.
So Jim, just your thoughts on, when you saw that, other than dropping your teeth, just talk a little bit about this. What you saw and how, and
I'll be
and
honest,
what your thoughts are going forward and making sure that, I know there's just certain amount, some you're not going to be able to get, but, talk about, general policy regarding
Sure.
libraries in general and how you see this type of surprise never happening again.
Well, I'll say this first. This is not the first time I've seen something like this happen when I've come into other library systems.
Sure.
It depends, partially on how aggressively you pursue the collection of fines. That's one thing that factors in, and we're not aggressive. We gently remind people that they
Right.
have these items out. But moving forward, the trend in libraries across the country really is to eliminate the collection of fines. There's a variety of reasons for that. Probably the largest reason for doing that is to reduce barriers to access.
Okay.
Folks who, either get into trouble and aren't able to pay off their fines will never come back to the library, or they may not come in the first place just because they're discouraged
Sure.
by the potential for that. And so from that standpoint alone, that's a motivator for eliminating the collection of fines. That doesn't mean forgetting that a book is not returned or an item is not returned.
I
we
understand.
would go out, continue to try and pursue and get those materials back. But as far as just the late fines, eliminating those is something that you see as a trend nationally. Chicago was one of the larger systems who have done this famously last year. They saw 240% return in the amount of materials coming back to them once they implemented the no fine strategy. And so the general condition they're seeing across the country is either your returns are kind of stable, they come back generally around the time that they're due, or you get a little bit better of a return. But they're not seeing this sort of situation where people just never bring back
Yeah.
the materials. So that would be my thinking moving forward, and it's certainly something we've been thinking about already, about how we might pursue that, eliminating fines.
So it becomes more of a conversation and a reward in trying to, collect the books back. You make sure that people are, getting the right books instead of, hammering people with a fine.
Right, exactly.
Pretty
We
much,
want
yeah.
to encourage people to come in and not discourage you. So, yeah.
Okay, thanks.
Is there any way to estimate, so this was over a long period of time, like about how much per year this is not collected on kind of average recent
So,
years?
Yeah, just looking at the past few years with our collection service, they've been returning up probably somewhere between $42,000 and $44,000. That's a combo of fines and payments for lost items, damaged items. So the total return we're seeing either with fines or paying for items is in the mid $40,000 range.
And the uncollected fines is about roughly how much?
That I don't know offhand. But yeah, we could dig into that.
Yeah. And do we have any sense for how much it costs us in terms of trying to collect the fines?
Yes. Every time we place a claim, it's $8.95 per account that we send to them. That's after the $50 threshold is hit. We send the account to the collection service. So I got some figures here. Let me pull this out. I want to say it's in the like $6,000 to $7,000 range generally, versus the $42,000 to $44,000 we'd get back, something along those lines.
But then we also spend internal resources trying to track down.
Yes,
Yeah.
right.
Do you have any way of kind of calculating the time or value of that?
Yeah,
from a
so
staff
we haven't
standpoint?
done that in front of those numbers, but yeah, before we send them to the collection service, we do our own due diligence to, try to reach out to them and bring the materials back. So there is effort involved in that part, yeah, for sure.
So, I mean, you make a pretty strong argument that maybe this whole effort to try to go extract this money back from folks who, lost a book or were late or whatever, is maybe just not a good use of resources and effort. And there's some good arguments to not use that as a tool. So, are you going to issue that recommendation to us, or is it still something that's being kind of vetted, or?
I would say that's forthcoming. We'd have to, we talk about in the course of the budget preparation. That would be the plan, I would suppose. But
Okay.
But that's certainly where where my heart lies is.
It sounds like a policy that has a lot of merit to me. Would just be my individual feedback. So, commissioners, any other questions or thoughts on any of this? All right.
I think we ought to hear, an alternative, that, the purpose of the library is to be open for people to be able to come in, be able to, get their books, have the time there, or go online and to be assisted, educated, strengthened in their spirit. Books do work wonders for people's souls, and they do. At the same time, you have the business that we have to run, and so what we need is good, solid recommendations. Obviously, there was a hole in the policy, and we're trying to fix it, and through some good, fiscal review, that has been discovered. And so what we need is a solid recommendation that balances all of that, and I don't think we're certainly not looking for anything like that today, but that's my thoughts, that we're looking for that. That's why it was discovered, is that it falls out of the box, and we're going to have to review that policy. And we certainly want personal accountability for people that, that use this facility and use this service. But we also want to make sure that we're not creating something that makes someone who has a definite need of coming in and using it more, that they don't use it because they got a $5 fine, so we need to balance all of that. So thanks for bringing it to us.
Absolutely.
All right. Thank you both.
Thank you.
Very much. Appreciate it. All right. Next up is a follow-up discussion on the family leave policy, and Sharon Burke is back with us to help us out on this item.
Good evening.
Good evening.
Afternoon. Blends. Hi. All right, so I'm coming back with information on the information on the Paid Family Leave Act as you all requested. Next slide, Max. Oh. All right, so one of the first questions that you all asked me was, what were the actual numbers that we're looking at for usage? And so what we're able to do is gather the 2019 data. And so out of the 2019 data, we had 33 employees that used the birth or family medical leave for birth, And then we had 74 families that used time off to care for a family member. So the total hours that we're looking at are for the birth of a child were 8,223, and for the time off with a family member is 5,633. Just so you are aware, one of the things we also did was aggregate the wages. So we took all the employees that used for the birth or all the employees that used the care, and we aggregated their wages. And so for the birth of a child, the average wage was $28.20, and the average wage for those that used for family care were $28.65. There we go. So the next piece is how did I get the data? And so what I wanted to make sure what we were aware of is the difference in what the deferred cost and what the temp costs I'm about to talk about. So the deferred costs is really what we're looking at as the employee's current salary that's in the budget, that if they were to go out on paid leave, we planned on paying for it anyway. And so what would happen is if they were to leave, there would be some liability there. For temp costs, that would be if we were to backfill their position for whatever period of time that you all grant. And what we looked at is typically for our family, if someone was going to stay home to take care of a family member, they typically do it right now intermittently. And so what did that look like? How would I calculate that figure? And so what we looked at is for the first 4 weeks, we did not take into consideration that the compensation would be coming out of that. And so the next slide is what are the deferred costs? Again, this is what the exact salary is. So if you're looking at our 33 employees that took time off to care for their babies or for adoptions, this is what you would look at if you offered a 6-week benefit, an 8-week benefit, a 10-week benefit, or a 12-week benefit. And again, current salary. Now this is for the care of a family member. And you'll see that it's significantly higher, but also look at the number is more than double. So this is for 74 employees. And again, I did it for 6, 8, 10, and 12 weeks for you. So in regards to a replacement cost, what did it look like? So again, if you look across the board where it says birth and adoption, 33 employees, for those amount of hours, if we took off the first 4 weeks, what we're looking at for someone who's gone for 6 weeks, you're looking at about $74,000 for the birth of a baby to backfill, $148 for somebody who's taking longer, 6, 8. And the same, right below it is the same data for if you're going to take care of a family member. And once again, when I calculated those dollar figures, I calculated based on the hourly rate that I mentioned earlier. So again, if you're looking at doing a 10-week or a 12-week, you'd be looking at that 6-figure or the 8-figure column. Any questions on that before I go further?
This is great, thank you. So just to clarify, as we're trying to think about total costs, would it be appropriate to add the 6 and the 8 column to the deferred salary costs in the previous slide? Or is that?
It's already budgeted, so this would be additional to whatever was budgeted, because we'd be paying that employee. It's already
regardless.
in the budget.
Okay, so the deferred salary cost is really, we shouldn't think
there.
about
No,
that as real
'cause you're gonna
costs.
pay
So
it anyhow.
if we're, so to just pause for a second and sort of try to drill down on what are the actual sort of projected annual costs of implementing
And
the paid leave policy,
Correct,
it would be this slide.
correct.
well, that's assuming you're going to hire a temp after 4 weeks, which may not necessarily be the case in everything.
Not in every case, and I think that's the,
That's why they're estimates.
Yeah.
exactly.
So to that point, if we were, again, just trying to kind of look at what we would anticipate the cost, say, of a 10 or 12-week plan to be, we would just total column 6 and 8.
Correct.
So we'd be at about 720,000 versus 1.3 million.
Correct. Now, just remember, we don't have a lot of extra employees hanging out. And so even if we don't necessarily backfill somebody, often you're going to have overtime,
Sure.
comp time charges that are going to incur. So there will always be something that's going to happen. But
Okay.
yeah. So if you did want to stagger, so we talked about staggering. So rather than offering 12 and 12, you might decide 12 and 8, and that's why the figures are listed this way, so you could have a better
Okay.
idea.
I have a question. How did you arrive at the estimate that 74 employees would utilize the benefit on the family?
So what I took was data that I actually had. So I took 2019 data, which is a fact, where I can say this is exactly what we used in 2019, and estimate that this is what it might look like. And I think, honestly, if you offer a heightened benefit, it's going to go up. I mean, people who may have chosen to come back early because they just couldn't afford, they didn't have the PTO, they might have come back early, taken an 8-week maternity or paternity versus, whatever it is that y'all might offer. And the same thing when it comes to care of a family member, they may not have had the PTO, and so they would have come back earlier.
Okay, I'm still a little unclear on what data you're looking at to make that estimate from, though. Could you just clarify
so the
that?
74 is not an estimate. That is actually how many people took that leave in 2019.
That somebody took the leave in 2019.
Took time off to take care of a family member.
But in most cases, they had to use their own time for that, right? So it seems like it will be a dramatically larger number if we are now saying to the organization,
Could be.
you get paid to, you can just do it and you still get paid just as much as if you were working.
It could be. I don't know what that number would be, so I went to exactly what I had, and so.
Okay, but your expectation is that these numbers will grow significantly if we create the new paid benefit as opposed to
Correct.
not having a paid benefit. That's the number of people who already do it not being paid.
This would be your low estimate, correct?
I mean, I don't even think it's an estimate. I don't think it is an estimate of what the new policy will cost. It's just it's a number that shows what happens today, but we don't have this policy today. This is a new benefit, right? So it's, and I guess in a way that's kind of my biggest question is, I mean, I want to support this, right? But I'm also trying to kind of wrap my brain around, like, how heavily is this going to be utilized throughout the organization, right? Because we need to understand how it'll, what are the financial costs, but also just how it affects organizational capacity too. So since it's new for us, we don't, we just have the backward-looking data, not the forward-looking yet. But is it possible to look at other local governments or other corporations? Many companies have policies just along these exact same lines that we're talking about that could help us understand the likely utilization. And the part that I'm most interested in is the time off to care for family members, because the births and adoptions and things like that are probably, it's probably easier to dial that in. You kind of know what that's going to be based on the past. But this other new benefit is it seems like it has the potential to be much more heavily utilized. So I don't know, any thoughts on those
Time off for a
questions?
family member.
I actually agree. I think the paid family care portion would be, it's something that our employees, we have employees that have sick family members. And so if they have the opportunity to stay home with their family and care for them, and, in regards to whatever their illness is, what a great opportunity. However, it does come with a cost.
But is there a way to, based on other organizations, have we looked at case studies of, this county did this 5 years ago, and, here's the percentage of employees who utilize the full 8 weeks or 10 weeks or 12 weeks. They utilized it every year, or they used high percentages of that
Right.
every year. So they're basically, a couple of months each
I can
year.
go back out to
A
my
lot of people
county-
are not working those periods of time.
Sorry, I
Yeah,
interrupted you. I can go back out to my county partners and see what they have for actual further data. It's, what they had offered were more of the 6 week and the 8 weeks.
I mean,
We
and
were going much more generous.
what percentage of pay are they doing? Is it, is it 100 across the board, or does it go, does the farther out you go, does it reduce? I mean, what are some of the models that?
What I saw didn't offer any kind of staggered when it came to their compensation. It was 100%. So during whatever that period of time was, they got, their full salary was made whole.
All right, you've got more info for us, so.
I got a little
feel
bit
free to-
more.
We didn't ask the question of the experience that they're seeing, how many more people are taking it.
Yeah.
We were really focusing on how many weeks they were given. And most people were in that 6 to 8 week range.
Okay.
We can go back and ask, what costs are you seeing? We did not ask that cost question.
And just, and again, just what the utilization is. I mean, is it, if we give 8 weeks or 10 weeks or wherever we land, is it, 5% of employees who utilize the full amount each year, or 10 or 15 or 20? Just, what are the experiences of similar organizations would be really helpful.
So this 107 was actual employees last year who used this, the FMLA. The numbers here, the 2, 4, those are just estimate. How many of those 107 did we fill in with a temp last year, or we paid overtime? Is these numbers to the right are just estimates so we really don't know how many of those 107 we actually put a temp in. Because, I mean, these numbers could, if, like you say, I have 107, if you only filled in 2 positions, these numbers are going to be way lower than this.
Typically when, because everyone's taking their own PTO, I know in one area, like Health and Human Services, they actually have hired, they have it built into their matrix where they actually hired additional people because their population tends to have more children. Others, they just got to figure it out. It's typically overtime, or, your exempts are going to pick up the weight on that. No, I'm sorry? So I have a couple more slides for you, too. So a couple of the questions that were asked last time had to do with our parents, that both of the parents, the parents actually work for Buncombe County. And the way our policy is written is directly because of the law. And so we are in compliance with the law. And so I just want to sort of take you over what the law for family medical actually requires us to do. But do know we can be more generous than the law. We just can't be more strict than the law, okay? So the key piece for this one is it just talks about what are some of the limitations in regards to the shared leave piece, and it's under fact sheet 28L. And so when we look at what are subject to the limitations, meaning that the spouses have to share that leave, it's the birth of the son or the daughter, it's the adoption, and it's also caring of a parent. Now that's important because the next one, oops, wrong way, sorry. The next one talks about that if I was going to stay home and care for my husband or my wife, or either one of my children, that's not included in the shared piece of the leave. Nor is it to take care of an employee with a serious health condition, or when we're playing with the military. So anything that has to do with exigency. Say that one 3 times fast, right? That also doesn't apply here. So are you all clear on this piece when it comes to the law? Because I know that was some confusion last week. And so at the end of the day, I've got some more work. You're asking me to get some utilization costs. So I guess one of the things I'd ask you to think about, because it looks like I have to come back with more information, is are you looking at, did you want to consider a staggered or a mirrored benefit, meaning that the parental and adoption leave would be exactly the same as the family care, or would you like to have the parent and adoption a greater benefit than the family care? What is the number of weeks that you all are looking at? And it may represent based on the data I'm able to get back. And did you want to offer a enhanced benefit for those married couples, so that way if my spouse works here, that he or she has the exact same benefit when it comes to FMLA that I have for all aspects of FMLA? If we were to go here, if I didn't have to give you more information, I would be asking for the public hearing, and then we'd need to vote to amend the ordinance.
Yeah, I
on
think
the
we got
FMLA.
to do a little bit more math, as they say.
I got to do a little bit more math.
That's it. So we got to be, you got to be really careful. We want to do the right thing, but this is taxpayer money, and we have to be careful with that.
Absolutely agree.
I think there's opportunity to improve. We just need to see it, what level we have the ability to go and be able to sustain it practically. We'll just see.
As we go backward and ask these questions, any other questions you need us to bring back? Any other?
I have one other question. So I've read the, some of the information about the policy as it relates to the care for family members. So my question is, could you sort of describe in maybe as kind of layman's terms as possible, the, if someone has some kind of, scary, serious health emergency in their families, of course, we all want people to be able to, respond to that and not have to worry about anything but focusing on that at the time. But of course, there's there's a wide range of kind of health conditions, from acute and sudden to, longer term and, the full spectrum. Could you describe, if we, regardless of how many weeks we end up choosing to provide on this, if we include this benefit, what are the kind of criteria for what an employee would be able to use to take the paid time off? Because it's not just sort of any
Correct.
illness, right? There's some criteria that we're going to be utilizing. Could you describe kind of
Certainly.
how that works and like what level of kind of seriousness or things like that would be covered under the policy?
So typically, the physician is the one that dictates what we do. I mean, I'll be honest with you. So if you had an employee that, let's say the spouse was in the hospital, the physician may say that it's my responsibility as a spouse to go sit by his or her bedside. It could be to drive my spouse to and from cancer treatments. It could be my responsibility to care for my spouse at home when they can't do the normal activities of daily living. It could be that my doctor says I need to sit by my mom or dad in the nursing home. So it could be that, it's in a place where someone is in a hospital where they've already been receiving care, but they're receiving the physical care, but not the actual mental or emotional care, which can be equally as important. We actually talked about that at our leadership team, and one of the things we discussed is, do we limit it to those that, the actual care piece? So if I had to take my husband back and forth or my spouse back and forth to the doctors for their treatments, or if I had to care for him or her at home for their treatments, those kinds of things, would that be better? But what we found is, if we're looking at true equity and we're offering, would it only benefit those that are at a higher salary range? Could I afford to stay home and not receive compensation because it didn't fall within this line of caring? I wanted to be there emotionally for my family member, but our policy didn't allow that. So if we had a lower earner, would they not be able to afford that? And is that true equity? And we at the leadership team said that really wasn't true equity.
Okay. And so did you say it's a physician's determination if it meets the criteria or not? Like an employee would be required to provide a letter from a physician saying,
Correct.
here's the care that's needed, and that would be the criteria if a physician's
Correct.
letters provided. Is that right?
Exactly. And a lot of times we enter into interactive discussion. However, if the physician says, it's this person needs to do this, then the employee, that's what we abide by, is what the physician is asking us. If it's something that, I would say there really is very few times that we will go against whatever the physician says. If there's ways that we can have some kind of accommodation, and again, it goes back into an interactive discussion. If we have an employee who could bring someone into the home because it's more of a home care kind of thing, and they're willing to, more often they're doing it because they've run out of paid leave already and they don't have that ability other than to, care for, or find alternate methods to care for, I should say.
Right. Commissioners, other questions? All right. So when are we going to have the next? So great information again. So what's the next step?
We'll go
in,
back
this
and try to get
deliberation?
answers. Did you
Yeah.
have a question? Sir? We'll go back and try to get answers. I do know that we've been reaching out to our county partners quite heavily, and a lot of them are still dealing with COVID and can't get some responses back as quickly as we would like. But if we do get those responses, we'll be back again in 2 weeks. If not, we would let you know what we're hearing back. At least, we would do a touch point at least next meeting.
I think the other thing too, we ought to look at options, whether it's, I mean, if this was a company benefit for them, you know, a governmental, you know, benefit, then you might even be phasing into an ultimate goal because you'd be testing the cost through the process. So, I mean, you know, we've said that we would like this, you know, well, maybe there's steps to that can be measured, you know. Maybe the benefits increased, you know, a little bit, and then we measure it and see how it works. And, you know, instead of, I mean, we got to know the cost. I mean, we can't, because once you offer the benefit, you're not going to roll it back.
Hard to pull back.
You're not going to roll it back. You can't.
Yeah.
Be hard
I'll
to
also
roll it
ask
back.
who did the full a phase-in or who did full adoption on that program.
I have one more question. So, when you made your presentation last time, they said if they take this leave,
Yes,
then the employee cannot turn in their vacation for pay
for 1 full year,
for 1 full year.
correct.
Is there something out there that says that if they were to leave, we could withhold part of that, or do we have to pay them when they leave vacation?
So, trying to recoup any kind of compensation after someone leaves it's very, very difficult.
His question is, do we pay them out their full accrued bank?
Oh,
Do we have to pay out that if they take this?
unless we have something in our policy that says we don't, then the law would require us to pay out.
All right.
Correct? Policy typically drives, so if our policy has very clear that if you do this, this, and this, then we don't pay out, then we can abide by that policy, but if we don't have it, then yes.
So from a salary perspective, truly, the only way we're going to be paying out anything is someone takes this 12 weeks and in a month decide to go to work for somebody else. If we don't have a policy, then we pay them all that, whatever vacation they have on their bank.
I'll be honest with you, with what we have right now, because I did ask this question of my benefits person, of the employees that have taken their full 12 weeks, has anyone left immediately after? And I only got one, and it was really, this person ended up going from full-time down to part-time simply because she had 4 children, and it just didn't make sense to put all 4 children into childcare.
Okay,
Now, there is that liability, but we aren't seeing it yet.
thank you.
All right.
Mr. Fruit, could you just remind us around the process points moving forward? This will be an ordinance change, so we'll need to do a public hearing, and then can you remind us of the?
That's correct. It's not required by law, but this
Okay.
board has adopted by ordinance the requirement for any amendment to the personnel ordinance to be a public hearing preceded by public notice in the paper 10 to 25 days before the hearing.
10 to 25 days before the hearing?
Right. That'd be the
Okay.
scope of time before the public hearing where the ad would have to appear in the newspaper.
Okay.
So that'd have to be a legal ad, yes.
Okay, so just as we think through our upcoming timeline, are folks wanting to do another discussion at our next October briefing or meeting? Or do people feel like we could receive the information by email and kind of weigh it that way and be prepared for a?
I mean, I like getting it like this. I mean, it's open, we're able to talk through it, and some good, you know, I think more decisions, better decisions come out when we're all able to kind of,
Okay.
you know, throw it out and hash it out. And, I mean, because it's better today. I mean, you know, we're gathering more information, we're learning more, we're asking more questions. The ultimate result is going to be a better benefit for the team members, wherever it lands. It'll be better, but we've just got to make sure that that not only can it be provided, but can we actually afford to do it.
Yeah, I'm just kind of trying to have us sort of think through how that process will unfold. So folks want to do a discussion at the next October meeting with updated data? Okay.
I would like to, but I would like to go ahead and, because she had asked the question, mirrored or staggered number, let's go ahead and give her, right now, let's decide now. You know, are we going to just mirror it with FMLA, or let's go ahead and decide on number of weeks, so when she brings back something, she can pinpoint to say, hey, this is where we would like to see.
So you can bring it all back, whatever you want.
Yeah, but I'm just saying, I would just like to give her some guidance to say, hey, let's do it mirrored. So figure mirrored. We're not going to stagger it. That's just a suggestion, so that you don't come back with
Lots of
a
information.
whole bunch of other stuff, and then we got to try to narrow it down again. So
We had specific questions. I'm asking Max to put back up that slide. One before that, Max. Can you go back to then, and then just one before the next steps?
Oh, next steps this way.
There you go. These were the decision points that we needed as we start crafting what would it look like in a policy. So, on the mirrored or staggered, and Sharon, you can speak to this, but when we were here last time, some of the comments that we heard were, should we have? Thank you. We were talking about, do we have the same benefit for parental leave, the birth of a child and care of a family, or do we have different weeks? So that was the staggered. Mirrored, it would be the same, or staggered, we could have 6 weeks for one, 8 weeks for the other, or 8 and 10, but it could be a staggered benefit. So we wanted to get where were you landing on that idea? The number of weeks, we'll take that back and get more information on the number of weeks. And then the last one was around the shared leave for both married employees. And that was around the FMLA, where you had to combine leave. If you were married, working for the county, you had to split that leave. Or would every employee have the same equal leave, regardless of marriage status? So those are the points that we would like some guidance and see where you're landing, and we can go forward from there.
So, I mean, I think there's to me, there's numbers associated with every one of these, you know, I mean, and if you're improving a benefit at any company you work for, let's just realize that is a positive move for those team members. And so if we're improving that benefit, then it will be helpful to those families without question, to their individuals, to their, you know, whoever they're caring for. What we have to do is just be very, very careful in how much is mirrored, how much is staggered, how much is, 2 weeks, 3 weeks, 10 weeks, how much is the cost, and how much is it shared for both? I mean, all those have to have for me, they just have numbers associated with it, so that, I just don't want us to forget the fact that whatever improvements we make is going to improve an already good program that we have. So, if we see the end result being way out here, we don't necessarily have to get there, immediately. If we're going in that direction, whatever we do is going to be an improvement to those families, and we just don't need to lose sight of that. But we got to have the numbers, on all of it. So,
I think the other thing too, and again, this is, it's out there. How do you show what the impact would be? But is on retention. What's it going to cost if someone stays home to care? That mom that stayed home to care for her 4 babies.
Yeah.
How much is it costing us to hire that person, train that person, and get them up to speed? I mean, it's, you're looking anywhere between $15,000 and $30,000 just out of the gate on that. And where's your sweet point?
So let me ask you this. I'm sorry. I'll say this, not hush. I know the quality of the team that we have at Buncombe County, and I know that I'm assuming what happens in most cases is that when somebody's out, that everybody knows that person and the reason they're out, and they kind of rally around that, and that we just don't all of a sudden go out and hire somebody.
Right.
It just doesn't happen like that, right? People take on more work. They do it just. So, that has to be taken into consideration when numbers come back to us, that we're not like other places with the quality of the.
Well, and I think so much of our work is specialized, so just to be able to take somebody in off the street,
Right.
They're ramping them up for training, so, you are correct. More often than not, it's going to be, the overtime or additional comp time or something like that. Just because, again, just the warm body isn't going to be able to do really what we're looking for.
Just to share my perspective as one commissioner on those 3 questions, I based on kind of the conversations we had, would support a mirrored policy of 10 or 12 weeks, and I want to see where the data lands. And would really appreciate some sort of staff guidance or recommendations on the spousal question. I know what the basement is under federal law. That was helpful to get that. But just around what seems like a fair, equitable way to approach it, understanding you're not wanting to, understanding we're wanting to be as fair as possible. And also you can imagine scenarios where a family could have more than one thing happen in a year very easily. One planned, one unplanned. And how we best support a family that works for the county that's navigating that. So if there could be any guidance or recommendations on that piece, I'd certainly recommend, appreciate that. But the mirrored and the 10 or 12 weeks is where I'm sitting right now based on what we've seen so far, and I look forward to that additional data.
Any other questions or comments at this time?
Thank you.
I would just say, I feel like I just don't have enough information yet to give guidance on any of those points yet, because I just need a better sense for like how heavily it's going to be utilized before I feel like I can make an informed, decision about these various questions. So for that reason, I'm not prepared to weigh in on those just yet.
You almost sound like Shark Tank when you said that.
You keep saying
for
that.
that reason, you're out. Is that what you're...
All right, Sharon, thank you so much. So we're going to talk about this again in 2 weeks at the briefing again. One other process question. To have the public hearing, do we need to have all of the exact language of what the personnel revisions would be, or could we, because we could go ahead and, if the answer is no, and we're just saying we're talking about this topic, we could actually go ahead and do the public hearing in 2 weeks and get that done. But do we need the exact language that we've decided to kind of go with in order to have the hearing?
I would think so.
We would at least need to have much more direction than we currently have.
Okay.
To feel comfortable. Ideally, we would have the language.
Okay. All right, so we need a little more time on that. All right. Very good. All right, thanks, everybody. All right, last item, Commissioner Penland asked that we have some more information on the issue at the polling places that we were emailed about, so.
We were emailed, I guess it was 3 weeks ago, about something that went on down at the Board of Elections, and then the email said that they were going to work, Sheriff's Office and EM was going to try to work a plan to make sure that our voting in Buncombe County is done safely and people aren't being intimidated. I just want to know if there is a plan in place. I was asked on Saturday, someone was concerned about going to the voting polls, and just want to know if there is something in place, or we're working on something to make sure that we do have a safe voting.
Ms. Pender, do you have any thoughts on that?
Yes, and we actually did a tabletop last week with all of those parties involved, and Fletch was part of that and one of the leaders of that, he and Taylor. So I'll ask him to brief on what happened at the tabletop, and we're from that tabletop and experience we're crafting what that policy will look like and plan so we'll be prepared for Election Day. So he can just give you a brief highlight on what we did on that tabletop.
Great.
Hello again. So even prior to the tabletop exercise we had last week, about 2 weeks before that, we met all the key players, election services, emergency services, us representing public health, Asheville Police Department, Buncombe County Sheriff's Department, all met and discussed, our biggest concerns going forward into election season, what we anticipate as our biggest threats. And then from that, working with AB Tech, at the AB Tech training facility, we sponsored that tabletop exercise last Wednesday. In the prior discussion, we discussed everything from, winter storms, an early winter storm, flooding, loss of power at specific sites, touched on some stuff we've seen across the country as other places open up early voting, some voter intimidation, some blocking parking lots, some trying to fake having long queues to get in. So we discussed some of that, and then everything up to the point of also this election will be unique because there's so many mail-in ballots that's going to be delayed for final counts. So talking about not just up to election day, but the week after the election, anticipating problems there. So last week's exercise focused on a couple of those key things. We focused on an early winter storm and loss of power at some voting sites, how we restore power, potentially move people, and then we focused on public unrest in the week following the election itself. And, as we're waiting for, maybe not locally, but within the state and even the nation, vote tallies to come in and people getting angsty because of that. So I get all the key players were involved. We're continuing dialogue. We plan to, as we lead up to election, early voting starting, very soon, continue that weekly dialogue with those groups and adapt as necessary.
And we also plan to have an EOC operations where all those members would be present that we can quickly deploy if that's the case. So, yes, sir.
All right. Yeah, and maybe just one follow-up question. If somebody, whether it's, early voting sites are going to start opening up pretty soon. So once there's the early voting sites and then the election day sites, if a person in the county is going to vote or whatever, if they see something that doesn't seem right, like, hey, this is voter intimidation, or, because obviously people have they also have their First Amendment rights, but if they see something that they're concerned about, who should they talk to? Could you talk about what's the process if folks see something they're worried about?
Right. Well, I apologize. I wasn't prepared to speak to this, but I know there are hotlines where you see any kind of, whether it's intimidation or have questions about what's going on at a polling site. There's state and national hotlines you can call. But also, if anyone does feel that there is intimidation or potential violence in escalating situations, they can call 911. The 911 call center is going to have a special, response set up for the next couple of weeks during early voting and voting day to have a slightly different response for polling sites than they normally would. But that was part of the planning process we went through. And we can reach out to voting services and make sure that hotline. I know they're having a campaign specifically to get that stuff out there, but there are hotlines to call, both regionally, statewide, and nationally for voting concerns.
Okay. But people could also call local 911 so that law enforcement can be dispatched to make sure everyone can vote and feel safe while they're doing so.
Correct.
Great.
We will work with Lillian in communications to make sure we get some messaging out of what numbers and best to call. So I'm looking around to make sure that that's captured, and we will make sure we have some messaging to the community.
Great. All right. Commissioners, that concludes all the items on our agenda for the briefing. So let's adjourn this meeting, and we'll reconvene at 5 o'clock for the regular meeting.